Welcome to Clinical Eye Openers. In this series, which we call How To, we focus on the issue of how to examine faces that talk to you. Faces that talk to you in clinical medicine can be called facies. This series consists of 5 parts. The first starts by describing an approach to the face, followed by an approach to the forehead and nose, the oral and perioral area, the mandible, and the ears. These short introductions are followed by a clinical gallery demonstrating the utility of this sort of an approach. Also, there is this particular video, but I must call your attention that there also is a PDF version. The PDF version has the advantage that you can read it at leisure, and it provides you with links to the Pandora word box, where you're going to find fuller versions of the images and fuller versions on the medical terminology. To view the video or the full PDF, you must be registered. Therefore, if you heard about the clinical eye openers, please make sure you register as soon as possible. I think you may ask yourself, who am I? Well, here am I. Here is my name, and from the picture you can determine that I am not a very junior pediatrician. In fact, I am a senior investigator of teratology. As a pediatrician, I'm mostly interested in environmental factors that pose risks to the developing child, both before and after birth. I just said developmental anomalies before and after birth, and I stressed environment. So that aspect of the clinical discipline is the definition of teratology. Also, I mentioned the importance of nomenclature. Clatura or clave or clutch means that the words are keys to specific notions or ideas, and that's what we are going to be emphasizing in words that are shown in red, and later on they are going to be listed at the end of each segment of this brief overview. So we said we were going to start with the face. Do you recognize this face? Why not? You should. This young man changed the world. He became an emperor. How come we can recognize him 200 years since he lived? Well, we still can recognize him 200 years later because his face is specific. We could say this is a facies of this particular individual and all the history associated with him. How are we going to look at that face? Well, first of all, I recommend that you remember this method. Symmetry. Are the left and right sides reasonably symmetric? They are never totally symmetric, but reasonably symmetric. Is the face and its features proportional, or is it disproportional? And if it is proportional or disproportional, are these features within the norm, or are they dysmorphic, that is, unusual shapes? Is the face overall round, elongated, triangular? Why not to note that? Is the midface flat, or are those cheekbones or malar areas prominent, as is typical of some of the ethnic groups in Eastern Asia? Is his face expressive or apathetic? Maybe his muscles are hypotonic and he cannot keep his lips closed. Is this face fit for what supposedly is his age, and his sex, and his ethnicity? Is he emaciated? Is he fat? Is the face edematous? Those are aspects that you should notice and keep in mind. And here he is again, the same individual, but over a decade later. His face is rounder. Maybe he gained weight. Notice the curvature of the upper lip. That is called the cupid bow. Notice that the corner of the mouth are at the same level as the midpoint of the lower lip. Notice that he's looking at you as if asking you, are you competent really to be my physician? How about his hairline? It's receding. The hair, well, it looks like he's getting bald. He's not bald yet, but he does have some degree of hypotrichosis, and trichos means hair. So again, that's a term that we need to list at the end of this presentation. Well, maybe we should look at these pictures in a fuller sense. So we go to Pandora word box, which you should visit systematically, and we'll see him in a fuller version. And there he is. According to the label under the picture, he is Bonaparte, Napoleon Bonaparte. And we see that essentially his chest and head are proportional, and as far as the face is concerned, we can see indeed that the hair looks sparse, the jaw is somewhat prominent, so is the chin, and the arms are proportional to these other parts. And here we see a full version of the second portrait, where we can be sure that he indeed has gained weight, and that the proportions of chest, abdomen, legs, arms, and head are reasonably within the norms of European males of this age category. What calls our attention is not only what is abnormal, but also what is normal. So his body proportions seem to fit the norm. The hair indeed is thinner now, so he has a more evident hypotrichosis, and his limbs are proportional. So some 100 or more years ago, the systematic study of faces became a discipline called physiognomy, and many physicians and others became over enthusiastic to an extent that the whole discipline became disreputable. People felt that they could tell by the face what was on the mind of many people, particularly potential criminals. Notice that indeed, according to this drawing, it is easy to show the difference in proportions between different ethnic groups, such as a European male on the left, and the last picture on the right is presumably a male of African descent. So indeed, physiognomy can tell you a lot about ethnic origin. It also can tell you about the mental status, not as much as people thought, but we can recognize facial expressions of people with limited mental development, and that is because when you don't use the facial muscles of expression, then they develop differently than if you are a person of superior intellect and gesticulate a lot. So please see in the Pandora word box further comments about physiognomy, face in general, and related images. And here all of you intuitively know that this face is not normal. This painting also illustrates that the artist that 500 years ago painted this image had trained eyes. Certainly, you can notice that it is a dysmorphic face. Perhaps you cannot explain in words why, but I think you would agree with me that the facial proportions here are altered, that it is rather round, that perhaps, I don't know if it is expressive or apathetic. This is an open question. Maybe you know, but I don't. I don't know the age of this individual, but maybe that color of the hair and the sparsity of the hair and the abnormal hair whorl in the middle and top of the scalp, all of these may be indications of premature aging. I don't know, but I already have a suspicion. Therefore, maybe this face does not match the age. I don't know the sex. I don't know exactly the ethnicity, but I know that there is some degree of adiposity. So, in the sum of sums, this is not a normal face. And anytime we see a dysmorphic face, the question is, what else? What else is dysmorphic? What other anomalies there may be there? Never examine a patient partially. Always examine a patient totally. So here it is. Here we see the patient in a bigger image. Notice that the left eye is slightly more open than the right. The teeth appear to be tiny. The upper lip is flat. There is no philtrum. These terms will be given at the end of this presentation. That perhaps the breasts are enlarged and represent gynecomastia, perhaps not, but there's no doubt that this individual has symmetric agenesis of distal upper limbs, and that in itself is a major question. Is this a syndrome? If it is a syndrome, is it due to environment, that is a teratogenic syndrome, or is it due to some kind of a genetic or cytogenetic or chromosomal defect? Is it static? That is, these anomalies appear at birth and the individual otherwise is stable, or is it dynamic? Maybe this is a metabolic disorder that during prenatal life prevented the development of the limbs, but postnatally may be acting in other ways by altering the metabolism's accumulation of fat and so on. Certainly this individual does not appear to be extremely intelligent. Moments ago, I mentioned that the face is an organ of expression. I think this image clearly reflects that this Roman emperor is worried. He has tribulations, and indeed, he was the first Roman emperor killed in battle. We cannot give you much of a history summary here, but you will find that in the Pandora word box. The fact that the face is an organ of expression reflects the function of facial muscles that insert in the facial skin, which are activated by psychological states of each individual. Individuals with limited mental capacity utilize facial muscles of expression either poorly or differently, and therefore it is possible for us at times, not always, recognize individuals with limited mental capacity, which in medical parlance can be referred to as oligophrenics, meaning diminished mind. So we have come to the end of this first module of the brief tutorial concerning how to look at a face. What we should remember is that individuals have unique genes, just like individuals have unique faces. That facial morphogenesis is under a complex genetic control, which includes hormones and factors related to puberty, hormonal or not, and aging, etc. However, there are some facial features that are under the control of a single gene, and we are going to show these later on in this tutorial. There are hundreds of dysmorphic syndromes that are associated with faces that clinicians should recognize, which is the similar process as we recognize our friends. Down syndrome was among these. Clinicians recognize a common character of children with Down syndrome and named it after an author called Dr. Down. This was possible many decades before the discovery of trisomy 21, which underscores that we can perform clinical diagnoses before we know the pathogenesis or the etiology of a particular disorder. This image here illustrates two halves of a face, the right half from a twin A and the left half from a twin B, and notice that they are virtually identical. And that is because these two twins have identical genes, and this in medical parlance means monozygotic, or in other words, derived from a single egg fertilized by a single sperm. Thus, both twins share identical twins. We mentioned that medical parlance, medical terminology, medical nomenclature, particularly in English, is a major aim of these presentations. In the previous images, we underscored in red critical terms that you should understand and use properly. Here they are listed in a very brief and informal manner. We recommend that you read about these terms in the Pandora word box to grasp fuller explanations. The emphasis in Pandora is on ideas. What are actually the notions that these terms emphasize? And we urge you to explore that on your own. So we are at the end of the first part of the brief tutorial about how to examine faces. We have focused on the face overall, and we now will continue by focusing on the forehead and nose. I stated we should have fun, so look at this image. Obviously, some people feel that they have a nose attached to their face, but others who have prominent noses feel like they are attached to a nose. So let's have fun. I see you next very soon, and my best to you.